Hello and welcome. Let me get myself all the way on here. My name is Julie Hirschberg. I am a neurologic physical therapist and the founder of Re+active Therapy and Wellness here in the Los Angeles area. And joining you live today on our Facebook page to talk about what we're learning and doing. We do this every week, and I love to share what I'm reading. I love reading books, reading research articles, and I do a lot of teaching, presenting to healthcare providers on various topics, but notably functional neurologic disorders. And last weekend I did uh, a short lecture discussion for a great conference. It was the Scripps Brain Injury Conference or course. And I talked on functional neurologic disorders, and I got a really great question. And so there was a very recent research article, it was a review article published that helped answer this question actually, but let me get you to the question first. And the question was from another fellow physical therapist who asked, well, how do you know when somebody has Parkinson's or they have MS or they have a stroke and they also seem to have a functional neurologic disorder? How do you know and how do you describe which symptom is what? It can be really confusing. And I absolutely agree. It can be very confusing. One of the things that I love is collaborating with other healthcare professionals. And I want to share an example of what a neurologist, Dr. Alan Wu, he's a movement disorders neurologist at Northwestern, what he did with clients. Now, I think what he does as a neurologist is much different than what I do as a physical therapist, or what an occupational therapist might do, or a speech therapist, because he's actually giving the diagnosis. We're not giving the diagnosis. But when someone comes to us with a movement problem or difficulty with their activities, they're coming to us to understand why. And part of what we're doing is screening for these symptoms and understanding which symptoms contribute to a movement problem. And so from a neurologist standpoint, he would actually make a pie chart. This was kind of the original pie chart. This was like from 10 years ago. He would start to make a pie chart. And he would say, I think 50% of what you're experiencing right now is from cerebral palsy, for example. And then I think there might be 25% that is from a functional neurologic disorder. And then there might be 25% that's from deconditioning, or maybe a cardiovascular disorder, right? So this was kind of a diagnostic pie chart. I found that super helpful, and the patients I was working with, would find it really helpful. So that I think coming from the neurologist, coming from the medical practitioner would be really helpful to help a person sort through some of their symptoms. Now, obviously, we don't always know, and we don't really know, is it truly 50%, right? Like there's not one test that tells us that, but there are, in functional neurologic disorders, there are very clear clinical signs that tell us this is a functional neurologic disorder versus this is not. So so that's kind of the neurology review. And then a really great researcher in the field of functional neurologic disorders, Selma Ibeck, and her co-author, Andrew Chan, put together a position paper that was published in August of this year. And it was in the European Journal of Neurology, and it was called The Borderland of Multiple Sclerosis and Functional Neurologic Disorder, a call for clinical research and vigilance. So this was not a randomized controlled trial. This is a position paper and a really nice review. And they start out by really saying, look, like FND is becoming very common. MS is also very common. And there are some similarities and differences and overlap, and misdiagnosis can happen. And this is an important piece because certainly if somebody gets diagnosed with MS and it's not, they're started on some pretty substantial medications that have side effects. Um, and they kind of their position here is, look, there are clear diagnostic criteria for functional neurologic disorder and MS, and using these will actually help better solidify a clear diagnosis, prevent unnecessary treatments, um, and speed up the person, if they have a functional neurologic disorder, getting the therapy, the integrated care. They actually advocate for multimodal integrated care in functional neurologic disorders. They also advocate for teaching young neurologists, and I would say let's advocate for teaching all of our healthcare professionals the how to distinguish these. Now, I would say clinically, and I've heard from other people as well, particularly in our Brain Bites group, that um, that we see both, right? We see them both together. We see the person diagnosed with MS who also has a functional neurologic disorder. And the good news is that we could treat them both, right? So that's what's really promising regardless of the diagnosis. So one of the things that the authors bring up is that in clinical practice, you can definitely see both functional neurologic disorder and MS. And there are some overlapping pieces here. Immunology, so neuroimmunology, MS is an autoimmune disorder. Um, uh, we can see immune system responses triggering functional neurologic disorders too. There's some overlapping kind of clinical signs and symptoms, particularly flares of symptoms that you can see in functional neurologic disorders and MS. And misdiagnosis either way is concerning for sure. They highlight in MS, and this is absolutely what I saw. So a little background, I did my residency 20 years ago, and over 20 years ago actually, and I was on the MS team. So I saw a lot of people with MS. MS misdiagnosis was very, very common. And these authors actually cite a few studies. I'm looking at the numbers here. Misdiagnosis rates as high as 58%. That is very, very high, meaning people got diagnosed with MS and they didn't actually have it. Now, where might this come from? Because there's clear diagnostic criteria for MS, and it includes positive findings in imaging. But what the authors note is that if there's misinterpretation of unspecific and brief symptoms associated with a pattern that doesn't fit a particular central nervous system localization. So what does that exactly mean? Central nervous system localization. I love this stuff. This is what I teach at USC, but you look for a pattern that, particularly in MS, because it's a central nervous system disorder, would match where a lesion might be, whether that's in the spinal cord, in the cerebellum, in the brainstem, or in the cortex. There are very clear patterns of sensory loss, of motor loss, of coordination deficits, of cranial nerve signs that localize to very specific areas in the brain. And if a person's symptoms are misinterpreted as a central nervous system pattern, they may be wrongly diagnosed as MS. So this clearly is a part of training, right? This is what we train physical therapists for screening. Also, unspecific MRI abnormalities. This has gotten much better in the field of MS as well, that there are very specific patterns in MRI on the MRI that are consistent with MS, versus a lot of the population has non-specific findings of the MRI that is not consistent with MS. And these authors argue that this can lead to a portion of patients who have FND being misdiagnosed as having MS. And this is certainly concerning, right? So there was a US based study, by the way, that found an 11% misdiagnosis rate as MS when it was actually functional neurologic disorder. That's significant. That is definitely something that should be on the list, and maybe even we're screening for in our patients with MS, is screening that they may have been misdiagnosed. So this potential 11%. So what does this mean? Like, what do we do as therapists? So, these authors talk about it's very well known that functional neurologic disorders can coexist with neurologic conditions. And this has been shown in the literature, coexisting with epilepsy. So psychogenic seizures can coexist with a seizure disorder. Parkinson's disease, so a functional movement disorder, functional tremor, functional dystonia, can coexist with Parkinson's disease. That's very well known. And the authors quote another study in patients with MS. 13% of the patients also appear to have functional symptoms with their MS. So they have the MS symptoms. So they have, so this, much like the question that the person asked me this past weekend, they might have the symptoms of MS. So they have spasticity, hyperreflexia, sensory loss in a central nervous system pattern, maybe cranial nerve or cerebellar signs, and they might have functional tremor, or they might have a fluctuating paralysis that occurs that's not an essential nervous system pattern. And so not just like either or, right? They have MS or they have functional neurologic disorder, but an and, like they could definitely have both. And it actually makes sense to me that people with neurologic disorders can absolutely have both, because what we understand, for example, of some of the underlying pathophysiology, those network changes in the brain that might cause a functional movement disorder, changes in attention and self-efficacy, for example, those would absolutely change in having MS or having Parkinson's. An impaired sense of self-agency, because you have a disease that fluctuates, that has relapses, that you can't control. Absolutely, you would feel a sense of self-agency, and you might have changes in the brain related to that that could then drive a functional movement disorder. So it makes a lot of sense. And it means too that we should be very careful when we do our evaluations. We should screen for functional symptoms, things like doing the Hoover sign, entrainment of tremor, looking at a change with attention and external focus. We should be screening this, and then hugely, we can be treating this. And this is what the authors state in this position paper as well, is this can also be treated all at the same time, right? So this is where incorporating some of those principles of treatment in functional neurologic disorder is going to help your clients with Parkinson's. It's going to help people with MS, maybe even stroke. And I think this is very promising for us, for sure. So bottom line, people with neurologic disorders can also have a functional neurologic disorder. We as therapists should be screening for it, for sure, and incorporating it into treatment, and incorporating those treatment principles. So by the way, if you're not already on our newsletter, sign up, reactiveeducation.com. If you're a therapist, reactivept.com. If you are a person with a neurologic disorder, we'll send out our newsletter, including these videos, including the articles that we talk about every week. And I want to remind you, one way you can sign up for our newsletter is get the download that we currently have, which is 10 things to avoid in functional neurologic disorders. And this is going to apply for folks with MS too. And this is going to apply for anybody who has Parkinson's and a functional movement disorder. So Brittany Kim created this great resource for us. It's called 10 Things to Avoid in if you're an orthoped working with functional neurologic disorders. It's full of great information. You can download it at reactiveeducation.com. So join our newsletter. I hope to see you on there. Thanks so much for joining me today, and I will see you soon. Have a great day.